Today's Fern educational session involves critical long COVID symptoms, brain fog and headache, fatigue and weakness, and chronic inflammations. What are their pathologies, how to clinically diagnose these patients, and how to optimize patient outcomes. My name is Edward Sloan. I'm Professor Emeritus in the Department of Emergency Medicine at the U of I in Chicago, and I'm Medical Director of the PA Studies Program at Dominican University in River Forest, Illinois. I am Fern President and Board Chair. I have no financial conflicts. You can find this information on our fern.org website and our YouTube channel at fern.org. This is a screenshot of our playlist page. I encourage you to go there for more neurological emergencies information. This is my contact information QR. Regarding the management of patients with long COVID symptoms, it's important to consider what nerve dysfunction meds might apply from other diseases to the treatment of patients with long COVID neurological symptoms. Regarding long COVID neuropsychiatric care, we know again that COVID-19 is a neurotropic virus. It causes long-term nerve dysfunction, and therefore it's important to consider nerve dysfunction medications such as Gabapentin, pregabalin, Amitriptyline, and nortriptyline. It's important to care for medical symptoms as they occur and the associated depression and anxiety that may result because of these medical symptoms. We note that anxiety and depression often occur because of the severity of symptoms long-term and because of an uncertainty regarding outcome. Patients don't know if they'll ever get better, and this reasonably does cause some degree of anxiety. So regarding the nerve meds Gabapentin and pregabalin, these medicines are commonly treating partial seizures, post-herpetic neuralgia, fibromyalgia, and restless leg syndromes. They also have been utilized in migraine headache patients, patients with interstitial cystitis, painful diabetic neuropathies, irritable bowel symptoms, anxiety, and mood disorders. We see that binding of the alpha-2 delta subunit decreases the depolarization-induced influx of calcium into neurons and reduces the release of excitatory neurotransmitters. In other words, these medications can reduce the inflammation seen in nerve cells as they communicate with one another. Two other meds used to treat patients with nerve disorders include amitriptyline and nortriptyline. These are both tricyclic antidepressants. These have been used successfully in patients with depression, chronic pain, diabetic neuropathy, myofascial pain, orofacial pain, post-herpetic neuralgia, smoking cessation, PTSD, and IBS. We see that amitriptyline is a tertiary amine. It has a strong binding affinity to the alpha-adrenergic, histamine, and muscarinic receptors. And it's the consensus that nortriptyline inhibits the reuptake of serotonin and norepinephrine by the presynaptic neural membrane, therefore or thereby increasing the concentration of those neurotransmitters in the synapse. When going to AI, we note there are 5 medications that may provide value in patients with long COVID symptoms. One is Gabapentin, which we've already noted is used to manage neuropathic pain. It may help with the chronic pain seen in some COVID patients, especially burning sensation in extremities and other tissues. However, its efficacy for COVID-19 induced olfactory dysfunction was not significantly different than that was seen with placebo. So, we know that pregabalin also is used for neuropathic pain, and it has been considered for managing chronic pain and anxiety in some long COVID patients. So, pregabalin may help to reduce symptoms like muscle pain and improve sleep quality. So, amitriptyline, a tricyclic antidepressant seen to treat post-COVID headaches and headaches that resemble tension-type headaches and migraines, is also seen to help in patients with sleep disturbances and chronic pain, such that it may provide value in reducing pain and enhancing restorative sleep in patients with long COVID symptoms. Nortriptyline, which has a similar purposes as amitriptyline, does help also with managing chronic pain, improving sleep, and alleviating symptoms of depression and anxiety in patients with long COVID. So in conclusion, regarding long COVID nerve dysfunction meds, we note the following. Gabapentin successfully targets neuropathic pain and the burning sensations noted in some long COVID patients. Gabapentin, however, did not improve COVID-related smell loss in clinical trials. Pregabalin helps to manage neuropathic pain, anxiety, and sleep issues in some long COVID patients. Amitriptyline effectively treats post-COVID headaches, sleep disturbances, and chronic pain. And lastly, we note nortriptyline also manages chronic pain, sleep disorders, depression, and anxiety in long COVID patients. Having discussed nerve-specific medications in the treatment of patients with long COVID symptoms, we now consider other medications that may be of value in patients who are sustaining long COVID that's disrupting an optimal lifestyle. One of these long COVID patient medications includes naltrexone. Low-dose naltrexone at doses far below those used for opioid dependence appears to downregulate pro-inflammatory cytokine production and reduce microglial brain immune cell activation. This immunomodulatory effect alleviates chronic pain, fatigue, and brain fog symptoms in long COVID patients. And this low-dose naltrexone medication can reset an overactive immune system without systemic side effects seen with other systemic immunosuppressive agents. Another potential long COVID patient medication are the SSRIs, or selective serotonin reuptake inhibitors. By modulating serotonin levels, SSRIs have an anti-inflammatory property which may impact immune signaling pathways and reduce neuroinflammation. This can improve mood, help with concentration, and reduce brain fog and fatigue seen in some long COVID patients. Aripiprazole, known as Abilify, is another long COVID patient medication that at low doses, this antipsychotic medication has shown promise in reducing neuroinflammation and modulating dopamine pathways. These actions lead to improvements in cognitive dysfunction and mood disturbances noted in some long COVID patients. So this reset of dysregulated brain circuits may help alleviate brain fog and related cognitive symptoms. Another long COVID patient medication which should be considered is metformin. Metformin, beyond its glucose-lowering effects in diabetes, has an anti-inflammatory and immunomodulatory property that may mitigate metabolic and vascular disturbance seen in long COVID. Observational research studies suggest that its use during acute COVID-19 might lower the risk or severity of post-acute sequelae by dampening excessive inflammatory responses and improving endothelial function. Lastly, intranasal corticosteroids should be considered for patients with persistent olfactory dysfunction that manifests by loss or alteration of smell. These intranasal corticosteroids can reduce localized inflammation within the nasal mucosa and may help to restore smell and alleviate related discomfort that may be seen because of immune-mediated tissue inflammation in the nasopharynx. And in conclusion, regarding meds specifically addressing long COVID patient symptoms, we note the following. Low-dose naltrexone reduces inflammation, alleviates chronic pain, fatigue, and brain fog in long COVID patients. SSRIs are seen to improve mood and cognition by reducing neuroinflammation. Low-dose aripiprazole modulates dopamine, aiding in cognitive dysfunction in long COVID patients. Metformin lowers risk in these long COVID patients via anti-inflammatory and endothelial benefits. And lastly, intranasal corticosteroids target inflammation to restore smell in those long COVID patients who have lost this sensory function. Thank you for participating in this Fern educational session. You can find this video and others on our YouTube channel at Fern.org. Have a good day.